Let's discuss about gas. Gas is everywhere. It is there around us. It is there in our stomach also. Everybody are suffering from gas. So let's discuss what is this gas. So gas is what we call bloating in English. It is a sense of fullness. The sense of fullness will be there even when you don't eat anything or after you eat something. That means even if you eat small amount of food, you feel heavy. That is called bloating. So it's reported by the people of all ages, as you know, and as you're reading everywhere, and as you're talking to people, they say that they have gas. So it is basically it is seen in irritable bowel syndrome and also other functional GI disorders. This gas or bloating is very difficult for patients to suffer and also for doctors to treat. So reasons for gas. You'll be wondering why I should know about these reasons for gas. Unless you know the reasons why gas is formed, it is very difficult to understand the treatment, what is advised by doctor. As you can see, I'll try to describe here. When we are talking, when you are swallowing, our air goes into the food pipe and then into the stomach. So the gas will reach the stomach. And we have all experienced belching here. And belching means the gas coming out to the mouth. We all have experienced that one. And that belching is the gas going from stomach into the esophagus, as you can see with this pointer. And small amount of gas is absorbed by the layers of the stomach, and the gas will go like this into the small bowel. And then the small bowel is very large, 6 to 8 feet. That is why it is indicated by the small straight lines. And then it goes to the large bowel, and then um, it will be farted out. The farting, this is called, the gas will go out to the anus. So why should we understand this? We should understand this because when there is um, excess production of gas inside the stomach or small bowel or in the large bowel or colon, then we'll feel this bloating sensation. Or when there is less transport of gas down the bowel like this. And the transport is less, the production is more, the gas is not absorbed by the walls of the stomach. This thing happens. And I have introduced this concept. This is already a known concept. This is a scientifically proven concept. The abnormal abdominal diaphragmatic refluxes. I will explain this one in detail in the coming slides, though it is complicated as of now. Psychosocial distress. You'll be wondering why psychosocial distress should cause any gas. So let's discuss about what does Rome 4 say. Rome criteria is a criteria for functional disorders. So we have functional dyspepsia here, which is formulated by the Rome Foundation. We have two types here. The epigastric pain syndrome is one, and it has epigastric pain and epigastric burning. And we have the other type, which is a postprandial distress type, where we have early satiety. That means feeling heavy after having a small meal and feeling heavy after the meal. And I want you to observe this thing very, very carefully. This is a normal human being, and this is the person who is having the gas problem. If you see here, the amount of gas in the stomach is and bowels are very, very less, around 56 ml of gas. But after having food, if you see, the gas is 86 ml here. It's not much high. It's a little bit 30 ml high. But if you see this one, the basal gas is very, very high. That is to the tune of 282 ml, or take it 300 ml approximately. And after having food, it has increased to nearly 508 ml. So what are these two conditions? If you see these two conditions, you can observe that the diaphragm is at this level, whereas in this patient, the diaphragm is at lower level. Okay, and so during hypervigilance, hyperanxiety, and during stressful conditions, the diaphragm is at lower level. That means the diaphragm contracts and the anterior abdominal muscles relax. This is the main problem. Okay, so how can we avoid this? We can avoid this by taking deep breaths, deep breathing. So coming to functional dyspepsia, if you see this functional dyspepsia, it contains of two predominantly overlapping conditions: epigastric pain syndrome and postprandial distress syndrome. The epigastric pain syndrome is a condition where the patient experiences pain and burning like fire in the stomach. Postprandial distress, after having a meal, the patient feels as if there is a weight inside the stomach. These two are part of the functional dyspepsia spectrum. So, what is the workup for gas? We'll take a history and we'll check for if there is any anemia, if there is any weight loss. If sometimes required, we can do an imaging and gastric emptying study. We can do an endoscopy. We can do stool studies and colonoscopy and some blood test. And we have to suspect small intestinal bacterial overgrowth. I have given this figure here again. You can see the movement of gas into the stomach, small bowel and large bowel. So we have to emphasize more on the history, like careful dietary history we should take. And there are some diet called FODMAP diet. This diet should be decreased. I have given the list of FODMAP diets in a picture. In the next slide, you can go through that and thereby uh, you can use this treatment at home. The best advice is to remove one of the uh, offending agents. This is the FODMAP diet. You can take a screenshot of this FODMAP diet and use it for your benefit at home. What is gut-brain axis? The brain influences the gut influences the brain. This is the gut-brain axis. How is the brain influence the gut and how does this happen? And the thing is, if you see here, when there is a behavioral abnormality, mood disturbance, and there is stress and anxiety, a lot of neurotransmitters will be released into the brain. And these neurotransmitters uh, will cause change in the motility of the bowels, secretion of the intestinal juices, nutrients, digestion, and also the bacterial balance or the microbial balance. So both the gut and brain, they interact with each other. So how to treat this gas problem? Exercise daily 1 hour a day and posture, sit upright, take deep breaths and see that the exhalation should be longer than the inhalation. Try to do relaxation techniques like yoga. You can use probiotics, especially BSL-3 was studied in many clinical studies and it is scientifically proven to benefit. And we also have antibiotics like rifaximin if in case there is a bacterial infection in the bowels. And if the person is having some mild or moderate anxiety, you can go with tricyclic antidepressants with the advice of a doctor. And you can try antispasmodics like mebeverine, botulinum bromide, all these things. And osmotic laxatives helps in the easy passage of the stool from the body. We can also use prokinetic agents and calcium channel blockers. So if you can see, I have taken this from a special article where if you see here, this is the trigger. What is the trigger? Infection, stress, both are triggers. The infection stress neurotransmitters cause change in the bowel function and they will develop symptoms and it is disrupts his activities of daily living and he will worry more about the health and this will cause disruption of his social and work life and increasing his anxiety and stress more and it again causes change in the bowel functions. So mindfulness, meditation, relaxation practices can manage your stress and IBS. So remember mindfulness meditation. This is abdominal breathing and sleep and exercise. The more you exercise, the more deep will be your sleep and you have less anxiety and stretching exercises. And we will discuss more about the abdominal breathing in the coming video.